the limbs are very stiff. It will be difficult to either flex or extend the limbs, and that is the hypertonia. And then dystonia, and when you are having an abnormal tone, maybe the child will do something like this, maybe deviating the leg or the limbs to one side. And then you have the limbs, either a mixture of hypotonia or hypertonia. Sometimes the limbs will be stiff, sometimes they will be plastic. And then we have muscle spasms. These muscle spasms are involuntary movements of the muscles, and some of them are very, very painful. And then you can have a fixed joint when the joint is fixed and very difficult to be flexed. And then we also have the abnormal neck movement of globus. These are different manifestations of the abnormal tone that we have in cerebral palsy. And then movement coordination, we have that spastic movement. So for you to walk, you need to extend and flex your limbs. So if you're not able to do that, then the movement becomes abnormal. So somebody can walk with a stiff leg without being able to flex it. And that's the spastic gait. And that's the most common type of gait abnormality that we have in cerebral palsy. Then we can also have the acetoid or the dyskinetic movement. We talked about that, those are normal movements of the limbs or the trunk. And then the ataxic movements when there is that unsteady gait. The person will be walking and be staggering. And then you have mixed movements abnormalities where you have either a combination of spastic gait and then ataxic movement. And then the other gait disturbances. Issue of balance is also affected in cerebral palsy. Because sometimes if a child has cerebral palsy and is having problem with balance, then he needs both hands for him to support himself. We expect that if a child is up to 6 months, he can sit by himself. But a child with cerebral palsy may need to use both hands to be able to support himself. And then the child may have difficulty balancing himself when he's not supporting himself with his hand. So if he's supporting himself with his hand, he can have balance. But once he removes his hand, then he starts staggering. And then the child may be unable to sit without the hand for support. The child may be swaying when he's standing. He will be having an unsteady gait while walking. And then be having difficulty with quick movement. You may be able to walk, but you cannot run. Because running requires quick movement. And then walking with normal gait. The gross motor dysfunction that we have in cerebral palsy include the impaired gross motor function. And this is the limited ability of a child to accomplish common physical skills or tasks, such as crawling. The child may be impaired in his ability to crawl. And if he's crawling, he may crawl in a normal way. The child may also have some limited ability to walk or run or jump or to maintain balance. And this usually involves the gross motor function, the ones that we can see easily. And then there is also delay in the physical activity. The child may not be able to achieve those physical development when he's supposed to achieve them. Then the fine motor function that are involved in cerebral palsy include the ability to grasp more objects. If you give the child a big object, he may be able to hold it. But if it's something small like a needle, it becomes difficult for the child to hold those tiny objects. And those are the fine motor functions. And then to be able to also hold an object between the thumb and the forefinger, the one we call the inside grasp. That is usually lacking in a child that has cerebral palsy. And then setting objects down gently. If you give a child table, he may not be able to bring it down to the table. He may just drop it because it's lacking that fine motor function. And then being able to use crayons for drawing. Children like drawing a lot, so he may not be able to do those drawing with crayons. And then turning pages of food is also a fine motor function that children with cerebral palsy may not be able to achieve. You may have to turn the pages for him to be able to move from one page to the other. Then the oral motor functions may also be affected, and then that includes the ability to talk. Children that have cerebral palsy, some of them may not be able to speak, and if they're speaking, the speech may not be very clear, and it has to do with the oral motor function. And then the ability to swallow, some of them may not be able to swallow, and if they are swallowing, they may have difficulty, and part of the food may actually enter the lungs and cause a problem. And then the ability to feed or chew substances, and then draining of saliva. Those are the different problems that may affect the child's oral motor function. So children that have cerebral palsy, as I said earlier, it has to do with the motor function. And because there is an injury that has affected the motor function, that injury could also have affected other parts of the brain. Okay, so, and if the injury affects other parts of the brain, then the child may have associated disability. And some of the associated disability that we have in children with cerebral palsy include the intellectual disability, where the child may find it difficult accomplishing, maybe being able to be educated because the child's intelligence quotient is lower than it should be. Then children with cerebral palsy may also have a seizure disorder. Some of them may be convulsing and they need to be given anticonvulsants to control that. Then some of them may have visual defects. They may find it difficult to see, or they may find it difficult focusing on objects properly. And then some of them may have hearing impairment. Okay? And then some may not be able to talk, they may have speech defects. And then we also have cognitive dysfunction, ability to learn and adapt may also be there. And then we have other behavioral problems, and then the attention deficit hyperactivity disorder. These are the problems that may be associated with cerebral palsy. But if a child has attention deficit hyperactivity disorder and he does not have a motor disability, we cannot call that cerebral palsy. Okay, so for us to say there's a cerebral palsy, that motor disability must be there first. And then if he has any of these other things, then we call them associated disabilities. So it's very, very important for us to identify children that have cerebral palsy early, so that we can start early intervention in order for them to have a better outcome. And there are different things that we can do in order to identify them early. And that includes the appropriate follow-up of children with no risk factors. We know there are some children that are born with the risk factors that we talked about, jaundice, severe metastasia, prematurity, and then meningitis. We need to follow these children up so that once they develop cerebral palsy, we can identify them early and then start early intervention. Then newborn examination is also very, very important. We do newborn examination, we may be able to identify children that will eventually develop cerebral palsy, and then we can intervene early. And then physical examination of children. When we see children, we need to examine them so that if there's any problem that may point to cerebral palsy, then they may have further evaluation for that. And some of the things that the movement of the limbs, once we notice that a child is having limited movement on one side of the body, that may prompt us that this child may be having cerebral palsy. And then if a child is having hand dominant before the age of 1 year, children that are less than 1 year, they can use either the left or the right freely. They don't have any preference for any particular limb. But once we are having hand dominant before the age of 1 year, it may tell us that something is happening to the other part of the body. Then we also need to educate mothers on the child developmental milestone. We need to tell them that this is the time this child is supposed to achieve so and so milestones. So that once they observe that there is a delay in achieving any particular milestone, then they need to seek medical intervention so that those that have cerebral palsy can be identified early and then start early intervention. Then the routine assessment of the mental milestones. So when a child comes for immunization, he needs to be looked at to see whether he's achieving the milestone that he's supposed to achieve. And if he's not achieving those milestones, then that child will also need proper evaluation. And then we need to train healthcare workers on early identification of signs and symptoms of cerebral palsy. I've seen a lot of children, I've seen so many doctors, and then the doctors are able to identify that the child has cerebral palsy. And some of those children will have missed that opportunity of receiving early intervention that will have bettered their outcome. So what is the goal of treatment with cerebral palsy? As I said earlier, cerebral palsy does not have any cure yet. So our goal is not to cure that child, but it's for us to help that child to attain his maximum potential and have a better quality life. And one of the things that we intend to achieve is to optimize mobility. Because cerebral palsy involves the ability of the child to move, we need to bring in efforts to help that child to move, because movement is important. For a child to actually have a good quality life, he should be able to move from one place to the other. Okay, so we need to start early physical therapy and then physical rehabilitation for us to be able to optimize the child's mobility and make it possible for the child to move from one place to the other. Then we need to manage the primary condition that the child is having. So depending on the problem the child is having, we need to manage that condition properly to make the child better. Yeah. And then control of pain. Because some of these children may have painful muscle spasms. We need to give them drugs that will help to control their pain. And then prevent and manage complications. Some of them may develop complications. I think when Avian was present, he has talked about some of the complications the child develops. So we need to follow them up so that once they have any complication, they will manage that. And then we also need to manage other associated conditions. If a child is having problem with vision, we need to correct that. If the child is having problem with hearing, we need to correct that. If the child is having seizures, we need to control that seizure in order to improve the child's outcome. And then we need to maximize independence. Because the child needs to attain that maximum potential for him to be independent. So we need to bring in things that will help the child to be independent. If the child cannot walk, then we can have assistive devices that will help the child to move around. And then to enhance social and peer interaction is very, very important. Your children, one of the things that help them to grow and develop is their ability to interact with other children. So that needs to be maximized so that the child will interact with other children, and that will also help the child to improve. And then to foster self-care so that the child will be able to take care of himself instead of relying on either the parents or other siblings to care for the child. We need to help the child foster self-care so that he will be able to do some of the functions that he needs to do for himself. Then to maximize communication by speech therapy, that will help to maximize communication so that the child will be able to communicate with other people. And then to enhance quality of life if we are able to do some of these things. And that's the goal that we want to achieve in treating children that have cerebral palsy. So treatment of cerebral palsy, as Avian has talked